you some pharmacology tips. They're great ways to remember all of these medications that we're supposed to know for the NCLEX. Somebody is taking NSAIDs. You need to watch their renal function. Think NSAIDs and nephro, N and N. For acetaminophen, this affects the liver. Think A for acetaminophen and A for alcohol, which is processed in the liver. A and A. Spironolactone is a diuretic. Think potassium sparing. SP spironolactone and SP sparing. For PT and INR, think Coumadin and warfarin. Try not to confuse it with APTT, which is heparin. Just think, if you write it PTT, the TT kind of looks like an H, so think heparin. Go over some drug endings. Something that ends in RIL, R-I-L. It's an ACE inhibitor. Think you're really going to pass this exam. Medication that ends in sartan, think ARB. Sartan, AR, and RB is an ARB, which stands for angiotensin 2 receptor blockers. Things that end in LOL or LOL are going to be your beta blockers. Just think you have one heart, so beta 1, and you have two lungs, so beta 2. A medication ending in prozol, like omeprazole, is a proton pump inhibitor. So think P for prozol and proton pump. Medication that ends in cane, think local anesthetic. Medications that end in FIL, which is FIL, are usually your erectile dysfunction medications. So sildenafil, vardenafil, tadalafil. These medications increase nitric oxide, which dilates the vessel and increases blood flow. So in other words, they help fill the penis. Now, a very big important one to remember, mixing insulins. So remember, not ready, comma, ready now. Let me explain it. First, you want to make sure that you're injecting air into the NPH. You're going to inject air into your regular. Then you're going to draw up your regular and then your NPH. Remember, when you are drawing it up, clear before cloudy. That's all I have right now. I hope that helps. It helps me out a ton when I took the NCLEX and still when I am a nurse on the floor now. If you have any questions or want any more explanation about anything, just drop it in the comments. Happy studying.